Hi, my name is Courtney Sensinger, and I will be discussing Part A of our condition presentation. My partner, Renee White, will be discussing Part B. Our condition was the neurodevelopmental intellectual developmental disability. Introduction. Intellectual disability, intellectual developmental disorder, is a disorder with onset during the developmental period that includes both intellectual and adaptive functioning deficits in conceptual, social, and practical domains. There are 3 criteria that must be met to be diagnosed with the disorder. The first is deficits in intellectual functions such as reasoning, problem-solving, planning, abstract thinking, judgment, academic learning, and learning from experience. This is confirmed by both clinical assessment and individualized, standardized intelligence testing. The second criteria is deficits in adaptive functioning that result in failure to meet developmental and sociocultural standards for personal independence and social responsibility. Without ongoing support, the adaptive deficits limit functioning in one or more activities of daily life. This is in such things as communication, social participation, and independent living. This is across multiple environments such as home, school, work, and community. The third criteria that must be met is the onset of intellectual and adaptive deficits during the developmental period. The video discusses neurodevelopmental disability primarily within South America, but did touch on the disability within the United States. The experts stated that 1 in 68 individuals will be diagnosed with a disability, but there is a belief that this number will increase. The onset of the disorder is not fully known, but it is estimated that 32 to 35% is genetics and the rest comes from environmental factors. During the developmental period between the ages 16 to 24 months, a child should be doing such things as pointing, trying to speak, and interacting socially. The expert encouraged parents, referring to mothers, to use their parental instincts if they do not notice these developmental milestones. The expert discussed the issue of children being diagnosed too late. One of the reasons for that is due to the problem with accessing services. Experts said that they would like to have children with disabilities diagnosed by age 2, if not earlier. This early diagnosis is so important because it is widely known that early intervention is key. Once a child is diagnosed, though, especially early on, the parents need to understand the barriers they may face. As mentioned, parents may face problems with accessing services, and this could be due to where they are located or their financial status. Another topic discussed was how we view children with a disability. We tend to project a view of a severe child as an adult. The expert discussed that there needs to be an attitude adjustment on how we view children with disabilities. A more hope, strength-based approach should be utilized.